Hello and welcome to the first of 4 educational mini-series presented and provided by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the host for the show today. Our first series is going to be all about Medicare, and we've got 4 different segments that we will be discussing different pieces on Medicare. Today's segment is called Understanding Your Supplemental Coverage. Our guest today is Dot Hartman, who's with us to talk about Medicare, and I would appreciate your time and information on Medicare with us. So let's get started because I know that we can talk a lot about Medicare. I believe we want to start actually with the first slide that will help us really begin the introduction on Medicare. So we have the first slide up, Dot, and so you wanted to show this specifically to review this with us, right?
Right. So understanding how you supplement it, you kind of want to step back and say, well, what do I have? You know, when I sign up for Medicare, what are the benefits that I have? And so I'm just showing the card here.
So this is the Medicare card we all get. Okay.
It's the original. It's showing the original Medicare Parts A and B, as they're known, and it has effective dates on it, and so that's important. Sometimes people start it at the same time, sometimes they don't. But whenever you're asking for help with Medicare, you do need to know what those dates are. So this is original Medicare Parts A and B. So let's just go over each part.
Okay.
In order. So Part A is what covers a hospital stay. Basically, it's the room and board at a hospital. There are obviously some additional things there that go along with that. Any blood that's received there. If someone needs follow-up visits by home health care after a hospital stay, that is also covered under Part A. And also hospice, if someone's eligible for hospice benefits, that's under Part A. And then one of the bigger things is if someone needs skilled nursing, so if they need to go to a rehab facility, say for 24-hour rehab, not just outpatient, but they need to be in a facility. As long as they've had a 3-day stay in a hospital, they do get 20 days covered free of charge for skilled nursing with their Part A medical benefit.
Okay, so really, the hospital coverage Part A does allow a little bit more in that than just the actual hospital stay, as you just said. Okay.
Right.
But it's related to the hospital stay.
Right. And the one thing that we're going to get into here in a little bit is when you're in the hospital, are you actually admitted or not admitted? Okay. So we want to clarify that in a little bit.
Okay. And some of these other areas in specific, like the hospice piece, our Berks County Area Agency on Aging has a specific show, regular monthly show that we did a program on hospice, and I know we've talked about some of these other issues with home care. So we'll come back to this. So we've got the Part A, which is the hospital piece. The bits and pieces under a hospital stay. Mm-hmm. You mentioned hospice and then also skilled nursing. Do you feel we've covered that you want to go to the Part B,
I mean, I think the big thing with the skilled nursing is that someone's actually been admitted for 3 days, admitted, not just observed, for Medicare to cover that. So if someone is maybe goes to the emergency room and they really haven't figured anything out necessarily, but they're not feeling like they can go back home. They might be thinking, well, let me go to a skilled nursing facility and, till I feel better. Well, that would be completely private pay. Okay, Medicare would not cover any of that.
Because the person wasn't admitted, they were kind of what we've come to know as observation. They've kind of been in the observation period of some place within the hospital that they've observed what's going on. They've given them some care. They're watching to see what happens, but not considered admitted.
Right.
Okay, and that's why that would be, if they would go then to a skilled nursing facility, would be private pay.
Right,
okay.
So it will not be covered by Medicare unless you've actually been admitted into the hospital. And then on to Part B is what people get, which is calling kind of general Medicare medical insurance, because Part B covers everything outside of the hospital stay and not the drugs at the drugstore, but it has a lot of other stuff in it. So it's doctors coming to visit you while you're in the hospital. It's any preventive care, it's any blood that would be given or drugs that are given in a facility, so that might be cancer drugs or injectable drugs, even your flu shot is under Part B, because that's something that's administered by a doctor. Any labs, x-rays, testing, diabetic strips that people use, syringes, needles for insulin, that is all under Part B, along with then durable medical equipment like oxygen and wheelchairs, hospital beds, that type of thing.
And those are all with a doctor's order.
Right.
Right.
Yeah,
So like I'm just thinking if I wanted to, have some kind of, when you said durable medical equipment, and I think I need something at home to help me, instead of just going to a provider and saying, here's my card, I want to make sure my doctor's ordered it for me or I'm paying out of pocket.
Exactly.
Okay.
Right. Yeah. So that is critical. Yes, you do need a prescription or a doctor's order for that. Any outpatient therapy would be in there as well, along with ambulance, and again home health care, and the home health care might be like wound care, follow-up wound care, or if someone isn't really healthy enough, they're considered homebound, they can actually get a doctor or a nurse to come to their house to see them for a checkup. That would be covered under if they can get someone to come do it, it's covered under Part B. So if someone is homebound, then Part B does cover a doctor or a nurse coming to the home.
But not necessarily. So when you were talking about home health, that's not necessarily somebody to come into a person with Medicare into their home to either do simple housework kinds of things like vacuuming and dusting, or it's not for care to get me out of bed or shower, right?
It's just medical attention.
Okay.
Yes, exactly. So those are things that are all under Part B. And Medicare in general pays 80% of the cost of that, and the participant would be responsible for 20% of the cost. So that's not a whole lot if it's just an x-ray or blood work, but if it's maybe an expensive CAT scan or an injectable cancer drug or something like that, 20% can be pretty significant.
Okay.
So this is why people start supplementing insurance.
Okay, thank you. I was just going to say, so now I understand, or at least have an idea of when we're talking about supplement. It's supplementing what isn't covered by that piece of it.
By the original Medicare, yeah. So you have 80% coverage with Part B things. With the hospital stay, there is a deductible. This year it was $1,260. If all you had was Part A, there would be a deductible. So again, people are choosing to not have those out of pockets and to get supplemental coverage. So this is where the whole, how do you do it gets
then that's the whole confusion. I guess what I wanted to first, if you have one sentence, because I know we also did a show on this, is there a time to get, you said in the beginning when we showed the Medicare card and we had Part A and B on that, and you said that could have different effective dates.
Right.
What's the time, when might I get which one? I mean, there's a definite time I get Part A or
and Part B, Yeah, so Part A, both Part A and B are available to anyone that's turned 65, and usually that would start on the month of the first day of the month that you turn 65. If someone is still working and has employer coverage, or their spouse is still working, they don't have to start Medicare A and B. They can wait until that person is no longer actively working and retired.
And when you say start, do you mean start using the benefits? But
or
you still
enroll.
to sign up.
I'm saying to enroll.
Okay.
So Part A is free. So most times people will start Part A when they turn 65, even though they may not, they may have employer coverage. But Part B does cost. This year it was $104.90 a month. So if you have employer coverage, there's really no reason to do that. So then that's why a lot of times Part A might be the first day of the month you turn 65, but Part B would be the first day of the month after you retired or your spouse has retired.
Okay,
so,
good. I just wanted to clarify that.
And you do that signing up through Social Security, just to clarify that as well. So so once you are signed up and you're wanting to supplement, then it's choosing, how do I do that? And there's really two paths that you can take.
And I think we want to get that slide up, right?
Let's show this one too. Thank you. Yeah. So this on this side we're showing keeping your original Medicare as the primary coverage that you have. Because that does not include any drugs, you would want to add a drug plan that you would use when you go to the drugstore with your prescriptions. And then you could get what's called a Medigap plan to supplement or to fill in what original Medicare isn't covering. So those Medigap plans will cover the Part A deductible, the Part B deductible, and the 20% coinsurance. And you have some choices there. There are different choices. You can decide maybe you want to pay the Part B deductible yourself, or there is an option to do a $20 copay for a doctor visit. So as always, we have choices. But
more confusing.
Yeah.
Yes.
And any of that, Medicare is the primary. So all you have to know is, does my doctor or facility take Medicare? So there's really no networks to worry about. So that's kind of an easy way. If anyone knows that they're going to be traveling a lot, go to Florida for part of the year, this is a good way to do your coverage, because you just have to make sure that wherever you're at takes Medicare. And who your Medigap policy is doesn't really matter, because if Medicare pays their part, the Medigap must pay the part that's remaining. If it's an expense that Medicare doesn't approve, then the Medigap's not going to pay it either. So it's really all about you having Medicare and the facility or doctor accepting Medicare for your services.
And so I want to clarify again. So in that case, in that scenario on the left side of that chart, if I have this Medigap in addition to Medicare Part A and B,
right,
and I go wherever, Medicare is the primary,
right,
and then it goes into that other Medigap, or can I call it the supplemental insurance I've purchased,
right,
because it's a purchasable thing, and I've got options as to what coverage I might want and the costs that are associated with that, right? Okay.
And these Medigap plans, they are medically underwritten, so everyone is guaranteed coverage for the first 6 months from when they start Part B. So you don't have to answer any medical questions then. But if you would wait more than 6 months from starting Part B, then they would ask you about your health. So you want to be kind of aware of that.
Mindful of that.
And they do go up in price as you age. These plans are paying the full 20% of whatever your Part B expense is. So they're taking on the risk. It doesn't matter if it's a blood test or if it's a CAT scan. They're going to pay that full 20%. So they are concerned about your health, and they're concerned about how old you are and what that might mean as to the frequency of testing and hospital stays, whatever you might have. So yeah, so that company is taking on the risk for you. So there are some pricing and medical conditions equated with that.
Okay.
On the other side, if we can pull the chart up again, is an option called Medicare Advantage Plans.
Yes.
And that's also known as Part C. Okay. We talked about Medicare A, B, and D is the drug part, and C is really a substitution. So you would never have A, B, C, and D. You would have A, B, and D, or you would have C by itself. So Part Cs are the HMOs and the PPOs that are offered. They are giving you Medicare benefits, but under a private insurance company. So when you have an Advantage plan, you no longer show your Medicare card. You only show the plan that you have, whether in our county it's Freedom Blue, Senior Blue, Humana, Aetna, just the big name insurance companies. They all have various Advantage plans. We have 40-some to choose from, in Berks County, so always choices.
So I have 40 to choose from if I'm going with this side. Okay.
Right. And so those will combine benefits at the hospital, outpatient drug benefits. There'll be some possibly additional vision and preventive dental, maybe some money towards hearing aids in those plans, hence the name Advantage Plans. But they set copays for everything. So you don't any longer have the deductible for the hospital stay or the deductible for Part B. You just have copays with this plan.
Okay.
So you pay as you use, basically.
Okay.
So you will have a monthly premium that you pay to the plan, and then copays when you use it. Obviously, the higher the monthly premium, hopefully the lower the copays. But they all have their own unique mix of benefits and what they think is important to people. Oftentimes, they'll have nice low copay for a primary care doctor, but obviously higher for a specialist. So people can kind of pick and choose based on their health. These plans are priced the same for anybody, any age, any condition. So there is no medical underwriting at all with these. Because basically, if you go to the hospital 6 times in a year, you're going to pay every time you go. So the insurance company isn't taking on as big of a risk, because you're going to pay as you use it.
Okay.
So that is another way that you can get Medicare benefits. Like I said, it's really kind of a substitution for original Medicare. It's getting it through another company.
So you had said that you wouldn't use that, and then you'd have Part C and Part D according to that chart. You'd have the Part C for all the other things we talked about that normally would be under the Medicare A and B, and then you'd have D also with the prescription.
Exactly.
On this one.
Right.
I guess my logical next question, Dot, and maybe I didn't, if you need to say anything else on on that Part C, in listening, how would I decide? It's like, do I go with A and B with this piece and the
Right.
supplement? It sounds like it might be more costly.
Right.
I don't know, though, and I know that you said it depends on, I assume, how healthy you are, the usage of
Right.
all the different labs and the work that you might need based on your health.
Yeah, it's based on your health, and obviously what your health is now may not be what it's going to be in the future.
Exactly.
So you're projecting a little bit. Also, your view of insurance, when people have original Medicare and the Medigap as secondary, they're paying, a premium for that Medigap, but then they know that's all they're going to pay. They don't have as much out of pocket. So if you like to have that kind of assurance that, I'm going to pay $150 a month, but then I'm covered, versus with the Advantage plan, you might get by with $50 a month and then pay if you use it. So it's kind of your budget, how you view a health insurance. You don't want to pay for something you're not going to use, or you like paying for it and know you're covered. A lot of different things that go in, as well as how much you travel. If you want to be able to see specialists out of the area without any problem, the Advantage plans do have the network, so you're always worried about does my doctor take it. A lot of different factors.
And if you travel and you know where you go, so like your
Right.
example was if they live in Florida for a few months and you've already checked out that where you live in Florida, some of those same insurance companies that are on this, that have the Part C coverage is there,
Right.
then you might be okay.
Right.
Okay.
Yeah, some of the companies do. If they have sister companies in other states, that's okay. But a lot to go into, and we help people sort through that. With the Apprise program that's sponsored through the Department of Aging, we don't sell any insurances, but we make you aware of everything that's available, and we try to help you sort through that.
So I can sit down with somebody and kind of talk about where I am medically,
Right.
what things I use in a year or I don't tend to use, whether it's
Right.
doctor's appointments and, as you said, the testing and the lab visits, what I anticipate, knowing my budget
Right.
as to
as
what
well.
I can afford.
Yeah.
Okay, so I can do that, great.
Exactly.
And then you also mentioned that there's some additional benefits that could be with the Medicare Advantage
Right.
grouping, such as the vision and,
The
okay.
dental. Right. So it's all about what's important to you and
Okay.
what financially you wanna take on.
Okay,
Yeah.
all righty.
So let's back up now a little bit and,
Okay.
and hit some more on that hospital stay.
Yes.
Because, the one thing that is new in Pennsylvania is now it is regulation that the hospitals must notify people if they're if they're considered admitted or just an observation. And the reason why that makes a difference is because of this whole A and B stuff. So if you're admitted, all your costs are falling under Part A, and you have that one-time deductible or whatever your supplemental has for a hospital stay. But if you're not admitted and you're in observation, then everything's under Part B, and you're co-paying for everything that happens there.
So everybody who comes in to see you in
Right.
observation, those specialists.
Right.
Okay.
It would all be in a co-pay arrangement.
Okay.
And again, depending on how you're supplementing, if you have Medicare and a Medigap, it may not matter much, but it would matter if you needed to go to skilled nursing, because you do have to be admitted for 3 days. So it's just,
and at this point too, you're not just talking about skilled nursing in terms of the permanent placement. You're talking also about the skilled nursing that now a lot of the skilled nursing facilities offer the rehab program.
Right, yeah.
So if they've had an incident, and that's the step to take care of by following through with the rehabilitation piece.
Right, exactly.
In a skilled nursing facility, then you're talking.
Right.
That's
so
why you also, it
Medicare's
covers that in terms of, you want to make sure you were admitted, so it would
cover that rehab, exactly. Yeah. So if obviously, you should be asking, am I admitted and I'm observation, but also have a family member realize that they need to be asking that question, because you may not be in any condition to be the one asking.
And it all looks the same. I mean, you're in a hospital bed, and you're in some room somewhere, but it isn't necessarily considered being admitted.
So hospitals, if they don't think you're going to be in for more than 2 nights, they don't have to admit you. So they're making a judgment call. But yeah, you definitely want to just kind of keep asking them, am I admitted or not? Because the horror stories are that people have been there a week under observation, and they had no idea.
And in the meantime, every day is costing them some money.
Racking up the copay. So,
and then it reflects when they do want to go further. Let's say to the other example of a skilled nursing facility for rehab, and realize, oh my goodness, now that's not going to be covered.
Right. Yeah, exactly. Okay. So it's an important thing. It's not that hospitals are trying to pull a fast one on you. It's just making sure you're aware of it, and then knowing how that's going to impact your costs. There's also another part that is available to people, if you want to display the chart there. If you do get discharged and you're not feeling like you're ready to go home, and again, this is another time when you probably want a family member to be helping in this decision, but they're saying they think you can go home, and you're like, no, I can't, and I don't have anybody at home maybe to help. A lot of it depends on what kind of support system you have where you are. But if you at all do not feel right about that decision, you have a right to appeal it. And so this is a phone number. This company, Levanta, is set up to cover multiple states, but it definitely covers our area in Pennsylvania. So you would want to call this number, and please write it down for future reference. So it's 1-866-815-5440, and then it's option 1. And you're just telling them that you've been given a discharge notice, you don't feel good about it, and they will review the case. It's like a third-party review. And they will notify your hospital, that you've put an appeal in, and so the hospital knows that they cannot discharge you until the appeal has been resolved. And obviously, they are on a fast turnaround.
And I was going to say, so is this a 24-hour number?
It is.
Because again, you can be told today, tomorrow, and today at 4:15.
Exactly.
And
it's 24-hour service, and they have to get back, I think, in 24 hours to say yes or no, they agree or don't agree. But you would not be discharged until that has been reviewed and either denied or said, yeah, it's okay. And this would apply to hospital as well as skilled nursing. Sometimes people are encouraged to leave skilled nursing before they're feeling ready to as well, for various reasons.
Complete therapy, and that they're feeling comfortable getting back in home into the groove again. Okay.
Right.
All right. Excellent. I guess you talked a little bit about that, about Medicare and what it covers. We had a couple of other things. I know you mentioned some of the Advantage plans and whatnot. Anything you wanted to get back on with saying anything about the Advantage care plans?
No, just that every year you do get a chance to change those. October 15th to December 7th is the time of year that if you're in a plan that you're not happy with, you can always make a change to the Advantage plan, or if you do happen to have a Medicare and then a prescription plan and a Medigap, you can always change your prescription plan, and it is good to look at that. Oftentimes people say, oh, I liked what it was, just keep going, but they may have changed. They have the right to change. So, you don't want to ignore, you're going to get notices and a lot of mail in October, but pay attention to the ones from your companies because they have important information in about what your premiums will be next year, what the copays will be with the drug plans, are they changing their formularies?
And they'll get that out in enough time so that somebody can get that and read it and then decide if they think this might be a time where I really want to consider what else is out there and make my change during that open enrollment period.
Right, yeah. The plans are supposed to have it out by October 1st. Sometimes it's more like the middle of October. But yeah, you have until December 7th to change. And that really is the only time you have to change. So, you don't want to be surprised by a higher monthly premium in January. Yeah. Then it's too late.
But it's an annual open enrollment. It's just that you would have to wait again to that following fall of that year.
Right.
In the few minutes that we have left in this particular segment, did you want to talk about
for the next segment.
Anything else that you may want to review in terms of any of the benefits in any of these, or want to say anything about maybe the prescription, the Part D piece in terms of
maybe the coverage gap, huh?
Yeah, we probably don't have enough time for that one. But again, also, I guess what I also want to say is that with the Apprise Health Insurance Counseling Program, you also will help folks with looking at their medications and then also their incomes and whatnot, so that we know that we might also qualify for something else that might be available, like PACE and PACE-Net to us.
Exactly. Yeah. With Ann mentioned about the drug costs. There are programs to help with those costs. So we have those applications. We can screen you with your financial information to see if you qualify for any assistance. And we're going to get talking in another segment on how to get even additional help with that Medicare Part B premium and other things. So there is assistance out there. And if not, if you don't qualify for the government plans, the pharmaceutical companies have some assistance as well with some of the higher priced drugs, so we can always look at that. Even though you have insurance, if you're falling into the coverage gap, the pharmaceutical assistance programs will help during those times. So hopefully there's something that can help, and we'll do our best to help you to sniff that stuff out so that you're able to afford your medications.
Is there one thing you'd like to leave with us in 1 minute? With regards to just understanding this coverage?
Yeah, I would say, if you feel like you don't understand your plan, please call us. We're happy to sit down with you any time of the year to help you understand it, because oftentimes if you haven't used it, you just don't know.
I haven't chosen my coverage. It's like, oh my goodness, where is that?
Yeah, so if you're not using it, you may not be aware of everything. So if you have questions, just give us a call. We can meet with you. We can help you over the phone.
And I think everybody's unique and different, so sometimes talking to your neighbor, your best friend, and they have one plan doesn't necessarily make it good for you based on all the things that we talked about earlier.
Right.
Well, that's the time that we have. I would just like to thank Dot Hartman. She is the Vice President of Community-Based Aging Services with Berks Encore. If you would like to make an appointment during the open enrollment period to review your information and your coverage, please give them a call at 610-374-3195. And again, anytime throughout the year that you have questions on any of this or the other programs, like the PACE and PACE-Net and other assistance programs, please feel free to give them a call. Thank you so much.